Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, giving you the update from Albany Medical Center. Today is Tuesday, August 4th. So Fred, let's jump into the numbers here. First graph is Capital Region, 8 counties, people admitted to hospitals in those 8 counties with COVID-19. That number is about 40. Fred, about the same.
For a month now, Dennis, yeah.
Yeah, for sure. Inside here at the Medical Center, the next graph is admissions above the line and discharges below the line. This also looks like it's looked now for a couple weeks. Some days we have 1 or 2 in or 1 or 2 out. Some days we have none. And I think, Fred, that speaks to the fact that people are doing the right thing in the region to try to keep these numbers down.
Yes, I think they are, Dennis.
Yeah.
It's really good.
Hospitalizations, of course, are a lagging indicator. They're sometimes 10 or 14 days beyond sort of our activities in the community, but this is a good news story.
Yes, it is.
Yeah.
Yep.
And then this graph here is the census in the hospital at Albany Medical Center in the morning for people with COVID-19. And this number is one of the lowest it's been in a while. We're now down to 12. And we have 11 on the floor, 1 in the ICU, none on ventilators.
None on ventilators.
Been a while.
Not since the end of June.
Right. And hopefully in a couple days we can report that number's under 10. Fred, today is Tuesday, and the governor will normally update us on activities with states that are on the quarantine list. And there is some changes in the list today.
Yes, today is you're on, you're off, you're on, you're off
Yes.
today. So today, Delaware came off the list. So
Okay.
you remember Delaware was on, off, off.
Okay.
Unfortunately, Rhode Island's on the list now.
Not good for
though.
some people, yeah.
Not good for some people, yes. And so that's the first Northeast state that's on the list. D.C. is off,
Okay.
But Puerto Rico is still on. So 34 states plus Puerto Rico are on the list.
So this is a very dynamic process, and as we've talked about, it means that we at the medical center have to be making sure that the list is current when we screen people coming in,
That's right, Dennis.
including our employees. And again, on Sunday, we had the ability for employees who are returning back from those states to come in and be tested. I think we heard 14 were tested. Did any test positive?
They all tested negative, which is great. Now, I'll say what I said at the safety brief, though. It's still very important for anyone who travels. Even if you have a negative test, you have to wear a mask, self-monitor, and be careful. You could convert later on, and we have seen some of that. So it's very, very important that you follow those recommendations.
And thank you to our staff who are obviously working on the weekend to do that. And good job to our workforce who are coming in and getting checked.
Yes, absolutely.
They're doing the right thing.
Yep, they're doing the right thing.
Because we've heard about other healthcare out there where people have come back and there is an outbreak. So we've got to be very careful.
And close to us, Bay State
Right.
in Springfield had a big outbreak related
Right.
to travel.
Fred, we are an academic medical center. We've talked about that in the past. We have 3 missions: clinical care, education, and research. And we're proud of all 3 missions. It's really what differentiates us from any other hospital within 25 counties.
Yes.
And one of the things we said we would update on is what's happening related to research here at Albany Medical Center related to COVID. The list is impressive. We won't get through it all, but let's just try.
So Dennis, you and I both
Yes.
have copies of this. They're titles of the different projects that are going on. We have more than 35
Incredible.
people in the organization involved in research, and they're in multiple departments and divisions. So the Department of Medicine, their Pulmonary Critical Care Division,
Yes.
Their Hospitalist Division, and their Cardiology Division all are participating in research. The Department of Emergency Medicine,
Yes.
something near and dear to you.
Absolutely.
They're doing some cool things. The research groups are also involved. So the Center for Molecular and Cell Physiology, the Center for Neuroscience and Experimental Therapeutics, and the Center for Immunology and Infectious Disease are all involved as well. So really there are some very, very interesting things going on.
Yeah.
Just to maybe highlight a few.
Sure.
We've talked about participating in the convalescent plasma protocol from Mayo. So that's ongoing, and we should be seeing some publications coming from that. There are a couple of drug trials where our pulmonary critical care folks are looking at new therapies that
Yes.
might help in the treatment of COVID. The cardiology division is looking at EKG changes, which we've talked about.
Yeah, you showed me one day, you said, Dennis, look at this EKG. What's it look like? I said, well, it looks like a heart attack. And you said, well, actually, it's someone with COVID.
It's a patient with COVID,
Yeah,
exactly.
which is very interesting.
And actually, our pulmonary group has published a paper on the use of steroids.
Yes.
And shown that steroids has been helpful in treating these patients. And that's also out there. A large trial has been published on dexamethasone.
So it's a really impressive list, and as I look through it, it occurs to me we're doing things based on diagnosis, based on lab testing, treatment, scientific research with the virus itself,
Yes.
All sorts of things. So it's really incredible, and congratulations to the people who are doing this work.
Yes, too many to name.
Too many to name.
But we appreciate all the efforts.
For sure. Fred, today is the very first day that our new medical students are on campus, the class of 2024. Welcome. And we mentioned that the dean, Dr. Verdial, will join us with a video message on Thursday for that.
That's
So
right.
we look forward to that.
Definitely looking forward to that.
We do welcome them on campus. There's a medical student in the first year class whose last name is McKenna. No relation.
No relation.
No relation.
No
I want to make sure she
Not
needs
part of the clan.
No, she needs to know that she's on her own, and I'm sure she's going to do great. So we welcome that whole class. Finally today, Fred, the weather is pretty inclement, and it's a great chance for us to recognize a special group of our employees who really, regardless if it's hot, if it's cold, if it's raining, if it's snowing, they're inside, they're outside, they're protecting us from the environment.
And that's the facilities group.
Right.
There are 140 individuals
Yes.
who, as you said, Dennis, shovel the snow, plow, make sure that we can get here in the wintertime, do things at all times
Yes.
of year to make this a safe facility for us.
Right. And their director of facilities maintenance is Eric Milanese. He does a remarkable job with his staff. And we just want to thank them because, we have to keep running 24/7. We never shut down.
That's right.
And one thing that we never worry about is whether or not we're going to be able to keep the doors open because we have the most incredible facilities team.
They're always on top of it.
They are indeed. And
We
so
hear
we
about it
thank
every
them.
morning.
Yeah.
Yep.
So that's it. We'll be back again on Thursday. And as I mentioned, we'll be hearing from the dean, which will be great. And we look forward to that.
Absolutely.
All right, good. So we'll be back in 2 days. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.